Hello, I'm Dr. Pramod Bhor, Director of Orthopedics, Fortis Hospital Vashi. Today I would like to speak upon a topic that is very dear to me, that is robotic knee replacement. Basically, advantages as well as disadvantages, why robotic knee replacement is needed. So when it comes to the indication for any kind of replacement, indication is osteoarthritis of knee. Osteoarthritis of knee is a degenerative condition which is most commonly seen in an elderly age group because of wear and tear of the knee joint. The femur and the tibial cartilages are worn out and the bone leading to deformities as well. So the treatment of osteoarthritis ranges from medicines, physiotherapy, exercises and up to a certain extent surgical treatments like a partial knee replacement or a total knee replacement. Partial knee replacement and total knee replacement are done in cases where no other treatment really works. We have been doing total knee replacement since last many years. It has been there. Me myself have been doing it since the last 18 years. So what is the need for robotic knee replacement? So we have been doing a knee replacement successfully since many years, but still there is certain amount of patients who are a little bit unhappy. Around 10 to 15% of the patient. We have been working hard. All the doctors have been working hard to give better results. Robotic knee replacements is a step towards that. We are able to give consistent results with robotics. So robotics ensures more precision, lesser blood loss, lesser bone loss. So how does robotic work? It is a CT based system where we require to do a CT scan of the patient prior to surgery. One day prior or before the surgery, we normally put that CT into a laptop in the software and do a pre-operative planning. So we already have a 3D or we have already done a virtual surgery on the laptop one day prior, 2 days prior to the surgery. We know how much the bone is going to get cut, what size implants we require to keep ready. If we can make any changes prior to surgery, we already do that. At the time of surgery, we do not require to open, rather I would say, as much as we require to do in a conventional knee replacement, because we already know that with this much amount of bone has to get cut. Plus, after the marking, we have a 3D image, again remark the bone, again we mark the bone on the real femur after opening the joint. There is a 3D image. This 3D image and the CT based 3D image are superimposed, and then we give a final call. Yes, this is how the bone should be cut, or this much amount of bone has to be cut. The robot then comes in action and makes the bony cuts or makes the bony changes. This is the only fully automatic robot that is available that makes this bone cuts. The rest of the robots, normally the surgeon holds a saw in the hand and the cuts are made by the surgeon. Because these cuts are made by the robot, they are more precise. They have a sub-millimetric accuracy. Because we do not open the joint too much, there is lesser pain. There is lesser blood loss as compared to a conventional knee replacement. So here at Fortis Hospital Vashi, we have done at least around 375 to 400 knee replacements in the last 1.5 to 2 years using this robot. After comparison with my conventional surgeries, I can definitely say that the pain, post-operative pain, is less by around 20 to 30%. Patients walk more easily with more confidence. They normally go home without a walker. The protocol remains the same for conventional as well as robotic. But yes, the recovery appears to be a bit faster in case of a robotic knee replacement. So that is why I would say robotic knee replacement is definitely gaining edge over the conventional knee replacement. These are the few points which I would say are important to know when you are planning a knee replacement. Disadvantage of a robotic knee replacement as compared to conventional knee replacement, definitely cost is one of the factor. Cost increases when you're doing a robotic knee replacement. Plus, secondly, if I can say, the surgeon requires quite a good amount of training. The surgical training for robotic is addition to a conventional knee replacement. So these are the only two disadvantages I would say. You have to have a trained robotic surgeon to do a robotic knee replacement, and the cost. So that is just about how the robotic knee replacement works, how it is helpful. Thank you very much.